Report: Professor Roland Gardner, Doctor of Sciences, Ludwig-Maximilians University from Munich. Diseases of the thyroid gland are widespread in Germany. Approximately 1 person in 3 is affected, often even not knowing about it. My name is Professor Roland Gardner. I work at the Munich University Clinic and deal particularly with diseases of the thyroid gland. The thyroid gland is one of the most important viscera of the human body. It produces and accumulates hormones that occupy the whole organism. The thyroid gland has the shape of a butterfly and is found below the larynx, being the shield of the trachea. Hormones production carried out by the thyroid gland is regulated by the signals of the pituitary gland. Such an element as iodine that comes into the organism with food plays a significant role in the course of formation of the thyroid gland hormones. The thyroid gland produces the thyroid hormones triiodothyronine T3 and thyroxine T4 from the iodine. T3 and T4 are accumulated in the thyroid gland at first. When the blood hormones level is going down, the thyroid gland releases hormones. They come to different parts of the body: brain, muscles, bones, heart, kidneys, reproductive system, gastrointestinal tract, nerves and skin. A healthy thyroid gland takes care of metabolism in the organism. Hyperactivity of the thyroid gland intensifies the metabolism of the organism and may lead to unexpected weight loss, perspiration, and anxiety. Hypoactivity of the thyroid gland leads to constipation, fatigue, and depression, since the metabolism of the organism runs low. An enlarged thyroid gland or a thyroid gland with nodular changes has a primordially normal function in the majority of cases. In the most cases, the reason is iodine deficiency in the organism. Men should daily consume 200 micrograms of iodine with food. If a less amount of iodine is received by the organism, an enough quantity of thyroid hormones is not produced. The cells of the thyroid gland swell and multiply out in order to receive more iodine from the blood. They appear as a so-called goiter. The goiter does not have any symptoms at first. In the goiter, they appear nodes that are not functionally active and cannot lead to hyperactivity, whatever they are functionally inactive and cause only local symptoms, such as difficulties with swallowing or induration in the throat. This disease may be prevented by using iodine-treated salt or iodized foodstuffs. Due to iodine-rich feeding, diseases of the thyroid gland, especially with the young people, have become rarer in comparison with 30 years earlier. Common causes of diseases of the thyroid gland are autoimmune diseases. They may become the cause of hyperactivity of the thyroid gland. This refers to the Graves' disease or hypoactivity, Hashimoto thyroiditis. As a conclusion, it may be mentioned that diseases of the thyroid gland caused by iodine deficiency can be easily prevented with the help of iodine-rich feeding, and autoimmune diseases are easily cured despite the fact that very often they are identified lately due to non-specific